Hi, everybody. I'm Butch Stearns here at HealthIT Insight Summit 2012. I'm with Denis Salins from First Medical Solutions. Hi, Dennis. How are you?
Good afternoon. Good. How are you?
Yeah, been a good conference so far, hasn't it?
It's been a great conference. It's been
Yeah.
a very good conference. Great speakers, great topic coverage, a lot of information.
Let me jump right into First Medical Solutions and First Medical Suite. You've been up on stage a couple of times today, and you talked specifically how you help doctors see more patients and how medical records are done more efficiently. Talk about First Medical Suite.
Correct. What we do is we design the software that was meant for the end user physicians, the smaller practices to the medium-sized practices, that help them get the information and manage their operations a lot better, but also be able to communicate with patients more clearly. So there's more transparency between the doctor's office and the patients. Ultimately, it improves patient care in the long run.
So as a company that's on the forefront of doing that, there's so many issues in healthcare IT now, especially, medical records and electronic medical records and health records and all of that. So I'll ask you the question this way. Where do you stand on access for that? Is it the more the merrier?
I believe it should be in the patient's hands. I think the patient should be in control of their
And the
medical
patient's
records.
control who should
Correct.
see them.
The patients control who sees them. The doctor will be a facilitator of information into it. But ultimately, the patient is responsible for their records because, as we all know, we're here and our doctors are not nearby. So if, God forbid, if something were to happen to us, if we had to go to the hospital, we should be ready with our information. Right now, our information is back home where none of us have easy access to it.
And when you first got up, you used First Medical Suite as a case study, an ROI case study, and it's making companies more efficient, isn't it?
Absolutely. It's doing wonders for our doctors, but also for the patient care in general.
So explain that. Talk about that a little bit more. What else do you like about it?
With patient care, what it's been doing is it's improving disease management. It's been improving care. It's been allowing the patients to manage their own health and become more responsible for their health. Because ultimately, the doctor explains the diseases, talks about the planes, and talks about what effect it's going on within the patient's body. But now with the patient system, they can track the information more clearly within themselves, so they can manage their health a lot more responsibly. The doctor's office likes it because now it allows the doctor's office to have a transparency with the patient, so that the doctor can now track the patient and see that they are taking a more proactive approach.
And so said a little differently, in my words, it can allow you to become your own advocate a little better, a little more efficiently.
Exactly. What it's doing is it's taking medicine from a reactive manner to a proactive manner, doing a preventative care for the patient rather than a reactive care.
Obviously, we thank you for being a sponsor of this year's event and being an exhibitor here. We're here nearing the end of day one of the conference, a two-day conference at the Harvard Club. I've found this conference very enlightening, very fast-moving. What'd you learn today?
I learned a lot of things. I learned a lot about security. I learned a lot about healthcare. I've learned that a lot of the great minds are here. We're putting together some plans. We all have our problems, but we're going to essentially forge forward and still make a solution in the end.
One of the questions I've been asking almost everybody here, I've found myself, whether it's hosting a webinar or involved in a lot of IT conversations, and no matter what industry somebody's in IT, one of the pain points that they commonly have is that nowadays there are all kinds of different people that want access to your key information within your organization. And now when you talk about healthcare, talk about health orgs, it adds a different level to that. Well, there's some unique things to healthcare that really add a different strain to IT professionals there, doesn't it?
Absolutely, absolutely. It's more secure, more worrisome for the patients, for the end users, but it's a hurdle that we can all overcome.
So what advice do you have? This is a loaded question, but where do IT professionals start to address the access within a company that people have to records and documents and your key information within your organization?
I like to start at the data level. I like to go to the encryption, move up to the security, which is the transportation level, and then be able to have the access level into it. Once you start from the bottom up, you essentially know that as you build your blocks going higher, you're more secure you're protecting your bottom base. So if you encrypt the data, if you have the secure communication in and out of the systems, and you have access levels into who sees it, privileged eyes only, I think you're in a good mode.
You know, it's interesting. Everyone I've asked that question has a different starting point. Gary Barnett, for example, from the Bathwick Group says, I'm going to have to start with the infrastructure. But then you all quickly follow it up with that it all has to go together.
Yes.
Like it all has to be happening at once because, you know, you can fix the debt all you want, but if it's not working, if the infrastructure is not working, you got a problem.
Exactly. I agree completely. It's either whether you want to fix the big picture and then narrow it down or start from the small picture and go outwards.
Well, Dennis, congratulations on your success.
Thank you
with
very
First Medical
much.
Solutions. And again, thanks for being a part of our event.
Absolutely, anytime. Thank
All right,
you.
he's Denis Salins from First Medical Solutions. I'm Butch Stearns. This is part of our coverage of the HealthIT IT Summit 2012.